Hello, my name is Alexandra Warner. I'm doing a musculoskeletal video for Health Assessment Fall 2010. This is my patient, Eric Warner. I'm going to ask his permission to do this video.
Yes.
Now I'm going to start. I'm first going to test for TMJ. Can you open your mouth? Close it, please. Can you open your mouth? Close it. Can you clench your teeth? And then relax. I'm going to do range of motion. I will do flexion. Can you open it all the way? Extension. Can you close it? Can you protrude? And retract your jaw in. I'm going to now move on to the shoulders. First I'm going to inspect them, and then I will palpate them and palpate the joints. Palpating the shoulders. I'm now palpating the sternoclavicular, the acromoclavicular, and then the glenohumeral. I'll move on to range of motion. I'm going to have your flex your arms out and over the top of your head. That's flexion. Then we are going to do extension. I need you to move your arms behind you. I'm going to do abduction. I need you to move your arms away from you. And adduction. I'll have you move your arms across your chest. One time. Now I'll do for internal rotation. I need you to put your arms behind your back as far as it'll go. And then the external rotation, I'll have you put your arms out and move them up. Now I'm going to do the elbows. I'm first going to inspect and then palpate. I would do this on both sides. I'm palpating the ocular process and epicondyli, and the joints are the humeral ulnar, radial humeral, and the radial ulnar. I'm going to do range of motion. I'm going to have him bend his elbow. This is flexion. Extension, I'll have him straighten his elbow. Supination, I will have him put his palms up. Pronation, I will have him put his palms down. I will do that on both sides. Now I'm going to move on to the wrist. I'm going to inspect it for heat, tenderness, anything abnormal. I'm going to inspect his hand. Now I'm going to palpate his wrist, palpate his hands, each joint. I'm feeling for his metaphalangeal, proximal interphalangeal, and the distal interphalangeal. On his wrist, I'm feeling for the radiocarpal, the distal-radial-ulnar, and the intracarpal. I am now going to do range of motion on his hands. I'll do flexion. I'll ask him to put his palms up and his fingers to the floor, or his palms down. Sorry, for flexion, I'll have him put his palms down and fingers to the floor. Now I'll ask him to put his fingers to the ceiling for extension. For adduction, I'll have him put his palms down and his fingers towards him. And for abduction, I'll ask him to put his fingers away from him. And now I will do the fingers and the thumbs. I've already felt for the joints and assessed them. I will have him do flexion on his fingers and thumb. I'll have him make a fist, both hands. That's flexion. Extension, I will have him extend and spread his fingers. For adduction, I will have him spread them out. And for abduction, I'll have him spread them in and back down. Now I'll have him do his thumb range of motion. I will have him do flexion towards him, extension out, abduction and adduction in and out. And opposition, I'll have him touch each finger. And that would be done on both sides. And now I will do gait and posture. I will have him stand and walk. As I'm watching his gait and posture, I'm also watching for his hips. I'm inspecting his stance and his swing. For his knee, I'm observing him walk and the way he walks with his knees. I'm now going to observe the spine. I'm looking from the side. I'm observing his cervical, thoracic, and lumbar curves. I'm assessing for symmetry. I am going to palpate his back. I will have him bend forward. For range of motion on flexion, I will feel his back at that time. I will also feel for the iliac crest. Okay, move it up. I am now going to look at the alignment of his shoulders and the skin below his buttocks. Now I will do range of motion. I just had him flex for the spinal column and touch his toes. Extension, I will have him lean back as far as possible. Okay. For rotation, I'll have him move side to side all the way. For a lateral bending, I will move him from his side to his waist. Now his neck, I will have him flex his chin to have him sit. And his chin to his chest. For flexion, extension, I will have him look to the ceiling. Rotation, I will have him look over each shoulder. Lateral bending, I will have him do ear to shoulder. Now I'll move on to hips. I inspected as he walked. I will have him lay back so I can palpate. I'm palpating. Now I'll move on to range of motion. I will have him pull his knee to his chest and pull it. Extension, I will have him his lower leg out and down over the side of the table. Abduction, I will have him move his lower leg away from midline, out. For adduction, I'll have him bend and move it towards midline. Internal rotation, I'll have him bend his knee and turn his lower leg and foot across the midline. And for internal rotation, I'll have him bend his knee and do it away from midline. Now I'm moving on to the knees. I am going to observe as he's walked in. I'm also going to inspect the knees for any swelling, masses, fluid noted at all. There's none. I'm going to feel his tibiofemoral joints and his patellofemoral joints. I'm now going to move on to range of motion. I'm going to have him bend his knee for flexion. Extension, I'll have him straighten his leg. Internal rotation, I'll have him swing his lower leg towards him. External rotation, I'll have him swing his lower leg away from him. I'll move on now to his ankles. I'm going to assess them. And then I'm going to palpate. I'm feeling for the ankles, the tibio, ulnar, and the subtalar. I'm feeling his foot also for his metatarsophalangeals, proximal and distal interphalangeals. I'm going to go on to range of motion. I'm going to do ankle flexion, where his foot will go to towards the floor. Extension, I'll have him move his foot towards the ceiling. Inversion, I will have him move his heel towards him. Eversion, I'll move his ankle outwards. I'm done with this part. I will move on to muscle strength. I'm going to have you push against my hands. 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 With your fingers. With your thumb. I'm going to have here. I'm going to have you push against my hands. Push against my hand. Now I'm done with my video. Thank you for taking the time to watch it.